Hi guys, this is Dr. Satyabama here for Raaonline, and the topic for today is infections of bone. Very small, simple topic. I'm going to be finishing it very quickly. Osteomyelitis. My concern for osteomyelitis with you guys with surgery is to understand. I'm not going into the depth of explaining to you about the saucerization, about the cloaca and all that. Just to understand that you need to treat the patient both surgically and medically, and an incision on HPO therapy is my talk for the day. So originates from the Greek word osteon, means infection of the medullary portion of the bone, that is osteon. History, pre-antibiotic era. Okay, we are not in pre-antibiotic, we are post-antibiotic era now. So pre-antibiotic era, acute onsets are there with suppuration and bone necrosis, which was a common finding. But after antibiotics, this is very rare. I would not say that it's very rare. Now we are finding more common with sclerotic bone, especially in men who are above 60-65 when they have a surgical procedure done in the mandible. Then you are having a localized osteomyelitis of the jaw that happens in that area. If you do not clean the area, do not give them proper antibiotics, and make sure and ensure, especially smoking men, okay, and ensure that you're not stopping his smoke, then you are in trouble. The osteomyelitis will spread and you have to treat it. This is how it was pre-antibiotic era. Look, the whole chunk of bone has to be removed. Saying that, we're not devoid of these presentations now. We do have such presentations. So, based on the hematogenous spread and the contagious spread in the direct spread or vascular insufficiency that is there, it's classified as suppurative osteomyelitis, which is acute and chronic. And chronic can be either primary or secondary, and if it happens in the infant, it's called infantile osteomyelitis. Non-suppurative because the bone is more hard and sclerosed in condition, and henceforth there is not enough intraosseous blood supply. Periosteal blood supply is minimal, endosseous blood supply is minimal, so it results in not healing bone. So, it can be focal or diffuse in chronic sclerosing, or in Gary sclerosing and actinomycotic osteomyelitis and radiation osteomyelitis. The sources of infection can happen from the periapical region or from the pocket, periodontal pocket, acute gingiva, contaminated problems, seeding through hematogenous spread, skin infections, foci can happen anywhere, and patients with uncontrolled diabetes, immunosuppression, all these are patients who are predisposing to osteomyelitis. Some of the predisposing conditions that are local damage, you caused a traumatic injury, traumatic extraction. If you're a learning person, you're an undergrad who's learning, a postgrad who's learning, okay, then what happens? You are ending up having exposed bone. You're really, you're not being very neat and clean with your procedure, and you resulted in a traumatic removal, a traumatic surgical methodology that will take time to heal, okay. If there is also blood supply compromised, then the healing will take a longer period of time, and also depends on the immunity status of the patient, okay. So, what is the patient present with? The signs and symptoms. The mandible is the most common affected. Anaerobic infections are very common, okay, and pain and swelling with pus formation. If the nervous system is involved, in peripheral, if there is a nerve in its vicinity, then that will be affected as well. Okay, unless the systemic symptoms will be minimal, okay, unless it is getting secondarily infected and having a underlying disease, okay, and patient will be toxic with fever and leukocytosis. The regional lymph nodes are usually, because it's an ongoing infection at the local area, the drainage lymph node will definitely be enlarged and tender. But radiographic changes take some time to present, and it will be a moth-eaten appearance on the radiograph. It will show dead bone appearing as dense, relatively dense areas, and subperiosteal new bone formation, which causes a buccal swelling, okay. Yeah. Pathology, we know most commonly it's the bacteroids, the anaerobes, bacteroids, Prevotella and Porphyromonas commonly involved. Staphylococci are also relatively present in certain areas. Mandible, limited blood supply, very commonly affected. Infection causing is acute inflammation, come on, and you have an X-ray, that's all. Osteobone myelitis, okay. The myelum of the bone, the marrow of the bone is inflamed, okay, and that can be either acute or chronic in its presentation. Whatever it is, it's just infection of bone. Treat it medically, treat it surgically.